I'm passionate about what I do because of the opportunity to help people achieve their hopes and dreams in their life. What I do is take care of athletes primarily. I assess their injuries and then try to help them fix them. That involves listening to their story of how they got hurt, trying to understand what the injury means to them as far as their athletic capabilities and their career, and then trying to diagnose accurately what's wrong with them so that we can design a treatment that'll be effective. I think it was a natural calling, honestly. I don't know what motivates me. I just think it's a natural predilection to try to do a good job. It's in my DNA to try to see what needs to get done and try to do it, whether it's being this orthopedic surgeon or trying to get better at chess. I love taking care of my patients, and I see their problems as challenges. And if I don't get the results that I'm wanting, I feel like I've been beaten. That makes me want to try even harder. When I started my career, I wasn't in medicine, but I'd always wanted to be a doctor when I went to college. I always was asked by my friends and peer group to help them solve their problems that were often medical. What do you think's wrong with me? Even before I went to medical school. And when I started thinking about being a doctor, I thought it would be really cool to try to help people and was really drawn to the profession. I was interested in medicine and particularly in orthopedic surgery for some reason. I can't tell you why. I had a friend who was an orthopedic surgeon, and I decided I would follow him around for a couple of days. I asked for permission, going from hospital to hospital, watching him do these pretty extreme surgeries. He was a spine surgeon by trade. But when I finished the 3 days with him, I said, you know, I'm going to do this. I launched into the path that it took to become a doctor after that, and it was a pretty arduous path, but it was fulfilling, and very glad I did it. After medical school, you get a residency program, and after you finish your residency program in orthopedic surgery, you're eligible to do a fellowship in sports medicine. I targeted his fellowship because it was considered to be the top one in the country, and thought maybe I had a chance of getting in, and applied. Training with him was unbelievable. You'd see these famous athletes every day come in for analysis and treatment and surgeries. And I got to participate in those things, got to help analyze them, help diagnose them, help do the operations. It was a great fellowship. It was like drinking from a fire hose, as they say. And I got to know pretty quickly that his motivation was he loved helping people. And that love drove all the other success that he had. When I graduated from the Cleveland Clinic program in residency in orthopedic surgery, I went around and interviewed all of my attending physicians that had trained me. Dr. Bergfeld said, if you always do in your heart what is best for your patients, you'll always be okay. And I understood what he meant. When you become the attending doctor, you really have to reconsider the responsibility because it goes way up. If you're the last guy in line for responsibility, not only is there a commitment to your patients to try to do right by them and try to help them as best you can, but there's also kind of a spiritual aspect to trying to give your all to your patients. And so if you do what in your heart is best for your patient, you'll always be okay. I found that to be true. As the years went on, what I realized is when you're nervous and frightened and worried about the future, somehow it works out just fine as long as you're taking good care of your patients. So that advice works both directions. It helps the patients and it helps the doctor. And I can say after doing it for over 25 years that it's a true piece of advice that I would recommend any doctor take if they can. And I realized a long time ago that life doesn't have a lot of meaning unless there's some hope for what comes next.